With us now is Dr. Kevin Kavanagh. Dr. Kavanagh is a retired physician and also founder of a becoming international organization called Health Watch USA. Good morning, Doctor.
Good morning, Jack.
How are you doing this morning?
Doing pretty well.
Health Watch USA has a newsletter, and you always make sure I get a copy of it, which I appreciate, with all the latest information. Is this available to anybody that's interested?
Yes, if they go to healthwatchusa.org, that's healthwatchusa.org, over at the left-hand column, you can sign up for the newsletter.
All right, give us the latest information on COVID-19.
Well, unfortunately, rates are still rising, and Kentucky is keeping up with past history of being rock bottom in its response. According to the New York Times, we have more cases over a 2-week average than anywhere else in the nation. And cases are still going up, along with hospitalizations and ICUs. The good news is we have not seen a substantial or concomitant increase in deaths. Of course, any death is substantial, wants to be avoided. And I hope that that holds. And also, we have ways of preventing this, such as following public health strategies, getting vaccinated, boosted, and if you do get an infection, please see your doctor immediately to determine if you are a candidate for Paxlovid, which is very important to start early at the onset of symptoms.
Now, the president was diagnosed and stayed away from folks for a number of days he was required to until he was no longer testing positive. Now he is retested positive. Now, this is a person that has done both of the COVID vaccines, both of the boosters, and was on Paxlovid. How's that happen?
Well, number one, this variant is starting to evade vaccines. So they, in my opinion, are not providing real adequate protection against infection. They still do appear to be good as far as preventing severe disease from being in the hospital and dying, but this is dependent that you keep your vaccination status current. Now, Paxlovid is a drug that I would view it more like it postpones the infection. In other words, it gives your body 5 days to build up its immunity so it can crush out the virus. Unfortunately, when you get older, your body's immune response isn't as great, and you may not actually be able to completely rid yourself of the infection. So in some people, it does tend to come back, but it's much milder than what you would have had at the onset. So that is how Paxlovid functions. It doesn't kill the virus itself. It inhibits its reproduction. In other words, it slows down the infection, allowing your body to catch up. And one of the big take-home messages is that the CDC guidance of off of work for 5 days, and then if you are asymptomatic, you can go back wearing a mask. That may not be stringent enough. It really needs to be viewed as being rock bottom. And in my opinion, probably people shouldn't be doing that. They should follow what President Biden did, as being off of work for 10 to 14 days. Make sure you test negative using a rapid test. And if you do get a rebound with Paxlovid, you may have to go back into isolation. So this is a virus we want to stop. It is one that is, at least from the initial data, appears to be more deadly and causing more severe disease than Omicron, but less severe disease than Delta. In all the studies I've seen, you don't see a huge increase in risks of death. And so there's some silver linings here, but only if we adopt public health advice and get ourselves vaccinated with your immunity up as high as possible.
What's the latest on monkeypox?
Well, monkeypox is still raging, and it's still primarily in the gay community. Right now, the United States has over 5,000 cases. That's the last data which I checked this morning. And I really think that everybody needs to take note that monkeypox is spread by close contact. During times of a pandemic, or when you start to see these cases increasing, it's not a good idea to have close, intimate contact with people who you're not related to. Right now, it is in the homosexual community and the gay community, but it could easily spill over to the heterosexuals. In Africa, This virus spreads quite rapidly and doesn't discriminate and even affects children. So this is something we want to guard against. We want to snuff it out. You want to refrain from your risky behavior and get vaccinated if you have any chance of being exposed.
Always good to talk to you, Dr. Kevin Kavanagh. Thank you, sir.
All right. Thank you, sir.